Hello, I'm Dr. Kathleen Wills from Optimal Wellness Limited. We are a clinic based in Epsom, Auckland, New Zealand. I am an integrative medical doctor, and I would like to share with you today some information on migraine headaches. The World Health Organization estimates that there are 20 million migraine attacks every day worldwide. And in New Zealand alone, there are to be some 200,000 people who suffer from migraines. Migraine is often occurring more in women than in men. It occurs in approximately 1 in 5 women, whereas in men it occurs 1 in 16. Migraines usually occur in late childhood, but also adulthood as well. And what is a migraine? A migraine actually is when it's a result of changes that occur in blood vessels within and around the brain. Various neurotransmitters, which are the chemical messengers in the brain, can cause these blood vessels to constrict or to become narrower and dilate or to become wider. The chemical messenger serotonin seems to play a major role in this sequence of events. Interestingly, several clinical studies have suggested that migraines can be due to drug-induced headaches. So what triggers a migraine? Food allergies, particularly to chocolate, cheese, beer, and wine, may cause blood vessels to expand. Hormonal imbalance is also a very important trigger. For example, if a woman is estrogen dominant, she might experience migraines. Also, women that are premenstrual have migraine attacks. Also, people with sensitivity to specific chemicals and preservatives in food, such as MSG, caffeine, and the like. Another trigger for migraine attacks is magnesium deficiency. This can be tested at our clinic. Emotional stress, of course. During stressful events, certain chemicals in the brain are released to combat the situation known as the fight or flight response. And this chemical can produce vascular changes that can cause a migraine. Changing weather conditions, excessive fatigue, skipping meals, and changes in your normal sleep pattern can also trigger migraine attacks. So what are the symptoms of a migraine attack? Usually it's sensitivity to light, noise, and odors. Some people see actual auras or light spots in their vision when one is going to come on. Some people experience nausea and vomiting from the pain, stomach upset, abdominal pain, a loss of appetite, sensations of being very warm or cold, paleness, fatigue, dizziness, blurred vision, diarrhea, and very occasionally a fever. So treatment at Optimal Wellness Clinic can involve several different therapies. The first one I would recommend is food allergy testing. We need to identify and remove triggers that would cause your migraines. I would also recommend nutritional supplementation. This can range from anything from vitamin B6 to an intravenous Myers cocktail, which can be very, very helpful even for an acute migraine. Within 10 to 15 minutes of having this intravenous therapy, many people with acute symptoms actually experience relief from the pain. Also, interestingly, oral 5-HTP, it's a natural supplement that affects your brain with the serotonin levels. This can be just as effective as for preventing a migraine as prescription medications that prevent migraines. We can also recommend herbal supplementations, as I'm an herbalist as well. So feverfew and ginger extracts are very good for migraine prevention. And finally, of course, we would work with you on lifestyle modifications. So working on your diet, what works, what doesn't work. I can give you referrals for biofeedback training and relaxation treatment, as well as some very effective acupuncture therapies. Thank you very much for listening to my talk today on migraines. I hope to see you soon. I'm Dr. Kathleen Wills.